Actually, all ladies require breast checkup because breast cancer has become such a frequent diagnosis. It is very common. The latest statistics say 1 in 8 ladies is susceptible to breast cancer, which is quite a lot. In a room of 10 patients, 10 ladies together in a room, and one would have breast cancer, and that is quite a high number. And breast cancer, if diagnosed early, can be treated quite well, and they have a very good prognosis. So it's very important to check up to pull out those ladies who are getting that early breast cancer. So it's definitely very, very important to get a regular checkup done. Not only ladies, men also can suffer from breast cancer. So if they have anything that they feel, any suspicious nodules, they should come up for a checkup. But largely this preventative measures and the screening is centered on ladies because it is so very common. Actually, every lady should do a checkup, but we have a protocol established because it's impossible to do a checkup for each and every lady in the world. And we see where the cancer age, what age it is more common, and that is the time we choose. So every lady over 40 years generally should come in for a checkup. According to the latest guidelines, every lady after 40 should have a yearly or an annual checkup, as we say. The rest of the investigations we have to do, like a mammogram or an ultrasound or a clinical checkup, all these are done when the patient comes in. But it is not that before 40 nothing should be done. Ladies between 20 and 40 years of age should be aware of breast related problems. If they do have something, they should come into the hospital for a checkup. And even if they don't have, at 35 years of age, one checkup should be done to find out something that may be coexisting and we don't know about it. Basically, it's after 40 years of age that a regular screening program is conducted. The checkup starts as soon as the lady walks in. We do a clinical checkup for the lady, and after getting her comfortable in the OPD, we guide her along. We show her how to examine her breasts on a regular basis so that she knows what to do at home, because we can't do it all the time for her. We guide her through the processes of the checkup and what is right and what is wrong. We do the checkup clinical examination ourselves. Then we do a preliminary examination, like a screening test, like a mammogram or an ultrasound, whatever is appropriate for her at that age. Then we guide her what is her protocol for treatment, when should she come for a regular checkup, and when should be her next checkup, what investigations are required, what are the alarm symptoms that she can expect, and how to basically better take care of her breast. We do keep calling for frequent checkup. Once a lady comes in and we find something abnormal, we do call them again. And sometimes patients do feel, are the doctors playing on us? Why so many checkups? But it is not like that. It's very important to distinguish between a normal breast, a diseased breast, and a cancerous breast. There are many different varieties. And breast is a very dynamic organ. There are so many changes that occur in a lady's lifetime in the breast that you cannot predict what is going to be the next stance or what is the next thing that is going to happen to her. So that is why a frequent checkup is required. And it leads to outcomes. We can pick up breast cancer early and treat the lady early. There may be breast cancer doesn't present with symptoms like pain, or it's not like appendicitis where the patient suddenly he feels so unwell that he has to come in. It may be slowly growing inside the breast without anybody's knowledge. That is why frequent checkups are required. And once we see something on an ultrasound which may not necessarily be a cancer, we need to understand what it is, how to follow it up, and what can be the prognostic factors, what can be the prognosis later for the lady. So it is better that they come for checkups when asked. That's a myth that most of the people have. We can not prevent breast cancer in any way. Nothing can prevent breast cancer. Not by diet, not by use of certain medications or vitamins or something of that. We have no control over it. The only thing we can do is pick it up at an early stage, at a stage where the cancer is just beginning to grow a little bit. If we can catch it at that stage, it is the best thing, because it just removes it from the patient and the patient can live a near normal healthy life after that once completely treated. It makes all the difference between having a healthy life later and of course being terminally ill. So that is why it is very important to have a checkup, but no, there is no way to prevent breast cancer.